there is something called independent therapy and dependent therapy. So let us try to understand the difference between this to understand eclectic counseling. For example, independent therapy means any therapy which you can use in one counseling completely without involving any other counseling methods or techniques. For example, if CBT can be used in any counseling. For example, somebody is having depression. Team, please come on the video. Suppose if I speak like this, will it be nice? Whoever is possible, please come on the video. If you are having any network issue or any other aspect, okay, no problem. Thank you for the people who have come on the video. Jerina Begum, Uday, Selma Berry, Asta. Thank you very much. Siji Shah, Dilip, Sakshi Agarwal, thank you very much. Thank you for coming on the video. And Rachel. Hi, Rachel. How are you? Hi, Rachel.
Good evening, sir. I'm good.
Yeah, thank you very much. Thank you very much for joining. So, for example, somebody is suffering from a depression. Only by using CBT, we can give the complete therapy. So we need not depend on any other therapy, or we need not depend on any other techniques from other therapies. Only by using CBT, we can give the complete counseling. So these kind of therapies are called independent therapies. For example, CBT, cognitive behavior therapy, rational emotive behavior therapy, neuro-linguistic programming, motivational interviewing, acceptance and commitment therapy, dialectical behavior therapy, gestalt therapy, cognitive processing therapy. So these all are some of the independent therapies. There is something called dependent therapies. The dependent therapies are, you cannot use those therapies exclusively in a therapy session. For example, somebody is suffering in depression. You cannot use only art therapy, play therapy, hypnotherapy. Even hypnotherapy is a dependent therapy only. It is not an independent therapy. Hypnotherapy is for mind only. Hypnotherapy is not for brain. So, if at all I want to use hypnotherapy, independent therapy, CBT I have to use, and hypnotherapy will be the dependent therapy. So that whoever trains hypnotherapy, only hypnotherapy, that will be failure. That will be failure. Only through hypnotherapy, nothing can be done. NLP, neuro-linguistic programming, says very clearly, anything you want to do it with your mind and body. It is not that only if you are doing with the brain, that will be failure. Only you are doing with your mind, that will be a failure. So you have to do it with both, that is brain and mind. So art therapy, play therapy, poem therapy, biblical therapy, hypnotherapy, logotherapy, these all are even sex therapy. These are all dependent therapy. It is not independent therapy. Now, there is something called eclectic counseling. Eclectic counseling means using all the therapies in one counselor. Suppose, for example, I will tell you a case which we will run through case study also, and we will see how that we can apply eclectic counseling. That is, how we can apply all the techniques, all the counseling therapies in one counseling itself. That we will see. So first let me tell the case. Okay, so let me open the form. Let me open the form. So this is a case study form which we have created in EMOCAP. Okay. So whatever counseling happens, we use this particular format. So name, usually we will not be using the a real name. Always we will be using only the a cover up name. Okay. So 1 second. There is a call. Just 1 second. One second. Okay. Sorry, there was a urgent call. So let me take you through a case and explain how to use eclectic therapy in that particular case. Okay. So the name, I am using some other name. It is whatever details I am putting. It is not the exact aspect. Okay. So the name I am taking cover up Raj. Cover up Raj. So his age is 48. His age is 48. So his phone number, I'm just putting something. Okay. Is it visible? Is it visible, Tim?
Yes, sir, it's visible.
Okay. So, so the place of living, the place where he is living is whether suppose usually in the format, in the case study format, you will be having whether they are living in urban or rural. So the client is from urban and his socio-economic status. You have lower class, middle class, upper class, and upper middle class and upper class. And he pertains to upper middle class. How that the client came? So the client came through referred by a doctor. He was referred by a doctor. And the marital status is he is unmarried. He is unmarried because he pertains to a particular religion. I don't want to tell the religion. Okay. The client is me. Okay. Next. His occupation, he is a priest. He is a priest. His education is, he has completed his MA in English. MA in English he has completed. And also he has completed MBed. MBed he has completed. And his religion, I don't want to say it here. Okay. So just I am putting XX. Okay. And his mother tongue is, he pertains to, his mother tongue is Malayalam. Okay. The mode of counseling is, which he did was offline. That is, he came to Ambattur. So I am submitting this form submitted successfully. Now, I'll be going to the actual form. 1 second. I'm opening the other form. Okay. Tim, is it visible? Tim, is it visible? Is it visible?
Yes, sir.
Okay. So back to dashboard. So these are the various cases which we have did today. Okay. So the old cases, it is only 6 cases will be on the frame. So these are the cases which we have done today. So cover Praju, add details. So I'm adding other details. Okay, so all these aspects will be available in the case study. So when you are doing a case study, all these aspects you have to fill it up. So here, if some column is not applicable, okay, so I can take this so that the particular complete aspect it will not be reflected. Okay. Now presenting complaints. Okay. The presenting complaint is actually the client is a priest. Is a priest. Please mute your calls. Team, please mute your calls. It is really disturbing. Please mute your calls. Okay. So the client is a priest, a woman, and a 18 years girl came to the priest telling their issues. He helped them. But in due course of time, a relationship came to the priest telling their issues. So he helped them, but in due course of time, a relationship between the daughter, who was 18 years old, happened. This relationship went for 2 years. 2 years. Both of them used to go to nearby city and take room and stay and have physical intimacy. It so happened that the girl's family arranged marriage for the girl. The priest also helped. The priest also helped the family, and marriage. Please mute your calls, Lebon. Please mute your calls. And marriage was fixed. One day, the girl called the priest and told that the boy seems creating problems, and she feels like committing suicide. Daily she started telling this, and the priest got fear, which developed as which developed more. Kainath Kapoor, please mute your calls. He was not able to sleep. He started getting headache. He was not able to carry on with the regular prayers. Okay, prayers. So this is what the presenting complaints. Duration. So this has been happening for 3 years. Okay. And mode of onset. The mode of onset is the fear. So he got fear. So he got fear. He got fear that he will get arrested. He will get arrested if she commits suicide. Suicide. So that fear was everything. So how the fear was happening? It was abrupt. How it was continuing? It was fluctuating, because one day it is there, one day it is not there. Nature, but it is progressive, because first it was for some time, but it started progressing. Okay, the precipitating factor. What is that precipitating the aspect is others. Okay, that is whenever the girl calls, he gets the problem. So relationship problems. Predisposing factor is the personality, his personality. History of presenting complaint. So this is a presenting complaint. This we will write it in depth. In depth we will write. So not able to sleep, not able to carry on with work, feel sudden fear and anxiety. The palpitation increases, and a kind of dizziness envelops the whole body. Okay, so social functioning, it is impaired, because he is not able to talk with others in a very cordial way. Occupational functioning impaired. So he is a medical history. So whether he is having any medical history, he is having hypertension. Okay, he is having hypertension. Psychotic history past, there was no psychological history. So it is not applicable. Okay. So he was not having any problem. So psychotic history, it is not there. So psychotic history, if not applicable, when we take this in case study, these aspects will not come. So family history, type of family, it is a nuclear family only. He is not yet married. Okay. He expressed emotions. He is having criticality. Psychotic history, illness in family, no. And this is not applicable. Birth and development, it is not applicable here. In his case, birth and development, how his life was, whether he was having any prenatal issue, whether he was having any intranatal things, birth weight, birth cry was there or not, was there any complications, and immunization schedule, developmental milestones, how it was, major physical illness during childhood, how it was, psychological problem during childhood, okay, and psychological problems in adolescence. All these aspects, it is not related here. So we will be putting this tick. So problems encountered during childhood and adolescence, he was not having anything. Home atmosphere during pregnancy, if it is a female. Home atmosphere during childhood. All these aspects are not pertaining to this particular history. So I am just putting a tick mark here so that it will not reflect. Educational history. So educational history, as I told, it is normal. He has completed his MA English and MEd. Okay, normal. So occupational history, occupational status is employed as a priest. He started working at the age of 24. Work record is satisfactory. Work satisfaction, now he is not having any work satisfaction. Frequent change of jobs, no. And he is not changing anything. Okay, so not applicable. So menstrual history, it is not applicable since he is a man. So we can just put a tick mark. Then marital history, he is not married. So that also we can put a tick mark. But if it is if it is a female, we will be writing when is that they attained puberty, regularity, premenstrual mood disturbance, and the other aspects. And if it is marital history, age of marriage, duration of marriage, type of marriage. So the type of marriage, whether arranged or unarranged, it will come several aspects. It will give marital satisfaction, sexual satisfaction, history of the marriage, knowledge of spouse about a patient's illness prior to marriage, if it is so, and marriage history short. So here it is not applicable. So I am writing marital history. Sexual history. Even though he is not married, he had sexual intercourse with the girl. Okay. So orientation, he is having same-sex orientation. Sexual functioning is, he is having hypersexuality and abnormal sexual behavior. Yes. Okay. Sexual history. So during the period of his relationship, he had sexual affair with the 18 and 19 years old girl, and he has shown perverted aspects as per his own statement. And marital status is unmarried. Okay, so he is single only. Substance history, if he is taking any substance, so he is not taking any substance. So I am just taking here. Premorbid personality. Attitude to self is over concern. Now he is over concerned. What will happen to me? What will happen to me? What will happen to me? Attitude to work and responsibilities. He was competent. He was competent when in his prayer work, etc. He was competent, but now he is having issues. Religious issues. Compliance is not there. Compliance is not there. If he is complaining, if he is having complaints, he would have not touched the girl. Okay, so it is permissiveness. Social relation actually is he acted as a leader. He acted as a leader, but not a leader. So adjustable. His mood is he is having mood swings. Leisure time spent alone. So whenever there is a free time, nowadays he used to sit alone and he used to brood. So mental status examination. General appearance and behavior. He looks one's age. Level of grooming. So always it will show different aspects. So level of grooming, he is adequate. He is adequate. Level of cleanliness, adequate, inadequate, overly clean, adequate. Mode of entry, came willingly. Attitude, he was having a cooperative attitude because he started sharing all the problems. Eye-to-eye contact, he was not able to maintain because of his guilt. He was having guilt, so he was not able to make eye-to-eye contact with the counselor. Hallucinatory behavior absent. Gesturing and posturing, it is normal, exaggerated, catatonic, normal. Gait disturbance, it is normal. Psychomotor activity, it is normal. So out of this, what is applicable that we will take? Speech. So initiation, it is a normal. Reaction time, a little bit. Immediately, it doesn't used to respond. It takes time. Tempo. Tempo is slow because of the guilt. Volume decreased. So very slowly only he speaks. Tone decreased. Coherent, incoherent. That is, he tells something and he repeats again. He repeats again, thinking that he has not told. Or sometimes he thinks that, okay, I have to tell one more time. So that is incoherent. Most of the things, what he talks is relevant. Speech sample recording by the therapist. Done. We have done the recording when he was talking, which we have played it to him to show that he is having this kind of aspect. Then mood effect. Mood is he was feeling confused. He was feeling confused, and affect. He was depressed, and range. It was exaggerated. Appropriateness, mood appropriateness is inappropriate. Please mute your calls, Sadia, Hussein. Thought, stream and form. It is, he was having thought block, thought alienation. So thought withdrawal was there. Obsessions. And as far as the obsession is concerned, he used to get the images of the girl like she is committing suicide, like that he used to get. Compulsions, he is having thought, that is, he is going on thinking that, okay, what will happen if she commits suicide? I will be arrested. Content. So overvalued ideas, yes, he was having, that is, he was having hopelessness. And he was suspicious that he will get arrested. Delusions. Delusions of control, it is poor. He was not able to control his various delusions. So that is poor. Perception. So audit. Yusuf Ali, please. I don't want to mute your calls, but if you people mute your calls yourself, will be very nice. Elementary. So auditory hallucinations, he was he used to get as if some people are saying you are going to be arrested, like that. So other perceptual disturbances. Okay. So depersonalization, that is, he is a priest and he depersonalizes himself. Higher mental function, attention, aroused with the difficulty. Orientation, he is oriented. Judgment, personal judgment, it was intact. Social judgment, that is intact. Test judgment, intact. Insight, actually he is aware that he is what he has done is wrong. So he is having intellectual insight that what he has done is wrong. Knowledge about mental illness, this is not applicable here. So adequate. Attitude towards illness and treatment, consent. So he is cooperating. Risk assessment. Risk to self, yes. So he gets a suicidal tendency. If yes, a level of risk, that is a low. He is having but low because he is taking tablets. Already he has visited psychiatrist and he is taking tablets. And risk to others. Risk to others, no, because he is alone. And risk to property, no. Okay, then so this is what happened. Now he comes for counseling. Now we are applying eclectic counseling. In this case, we are using eclectic counseling. So if we are using eclectic counseling, how that we will treat it. So intervention, what is the intervention we will do? So first time when he came for intervention, okay. So that was what we did is we tried to we trained him in 1 minute mindfulness. 1 minute mindfulness. Okay, that is number one. Intervention given. Number one, trained in 1 minute mindfulness. Then we so this 1 minute mindfulness, it is from CBT, from acceptance and commitment therapy. See, whatever has happened, that he has to accept it. So from acceptance and commitment therapy, we have trained him on leaf floating exercise. We asked him to practice. Then we trained him in the REBT. We trained him in REBT, that is A, B, C, D, E. We trained him in A, B, C, D, E, wherein A is activating event, B is a irrational belief, C is a consequence, D is a disputing, and E is empowering. We did this in the counseling session, and we trained him to do the same thing in his home. We told him, you go to home. Whenever the thought comes, you do this. Activating event, the girl image. Belief, irrational belief. Definitely she will commit suicide. Consequence, you feel hands trembling. You are getting headache, palpitation increases. Dispute. For how many years she is telling this? For more than 7 months she is telling that. So did she commit suicide? No. So even though she is just telling, she has not did anything like that. So that is a disputing. And empower him with, okay, hereafter don't do anything nonsense. But in this case, try to help them and slowly come out. Slowly come out. So A, B, C, D, E. So in the first session, we trained this. Okay. So if you see, that is eclectic counseling, because we have used ACT and also we have used REBT. In the intervention second session, we have used irrational belief questioning. So we have created, there is 100 questions related to irrational belief. That 100 questions related to irrational belief, we have asked the individual. I think that the question was prepared by Sakshi Agarwal. Sakshi, you only prepared, isn't it? That negative irrational belief, did you prepare?
No, sir, only few questions I prepared.
Acha. So I think someone from our team, only diploma student only prepared irrational belief questioning. 100 questions we have prepared and we have asked it on the second session. That is actually disputing. That is REBT. And also, this is one. Then we psycho-educated him about cognitive distortions. We trained him about cognitive distortions, and he was able to identify that he is having mental filter. This is one of the cognitive distortion. He is having a mental filter. And he is having emotional reasoning. And he is having jumping to conclusion. All these cognitive distortions he was having. And by using the disputing techniques, we try to empower. In the third session, we did hypnotherapy. In hypnotherapy, we try to remove his fear. Using the staple method. we this is actually by using a metaphor method. We did hypnotherapy and we trained him in hypnotherapy, and we made him to practice hypnotherapy in his house every day. And that we did it in the third session. In the fourth session, we reviewed his. In the first session, actually, we gave him. In the first session, we also gave him thought record sheets. We gave him thought record sheets from cognitive behavior therapy. So, in the fourth session, we reviewed the thought record sheets, and we pointed out what are the areas the negative automatic thinking has to be changed. That we told him, and we trained him in the technique contact. So one is contact with the reality. The another one is contact with the image of the woman, girl. So when he is coming into the contact of a reality, that is today, present, where the girl is not available, he has to come into contact of the reality, but he is not in contact of reality. He is in contact with the past. So we trained him through a Gestalt therapy. In Gestalt therapy, this contact we made him to understand through the chair method, open chair. The open chair method. We made him to. We asked him to. That is open chair means that is empty chair. Empty chair technique. Empty chair technique. So we made him to sit in one chair. In the another chair, we asked him to assume the girl and start talking. This we did on the fourth session. And in last two sessions, we did logotherapy with him. That is meaning of his life. And meeting with his fears. And we trained him in autogenic exercise. So it took around 8 sessions. After 8 sessions, he became near normal. I cannot say absolutely normal, near normal. And we have fixed the next follow-up next month. So this is what using eclectic counseling, and also please mute your calls. Ananya, please mute your calls. Ananya, please mute your calls. Now I am saving the changes. So I have saved the changes. Now I can take a PDF of this. Now, for example, the PDF is downloaded. The PDF is downloaded, and this is the PDF. The PDF I'm showing you people. So this is the PDF. Okay. So psychological disorders, a case study. Okay. So age. So all the details, whatever we have put, presenting complaints, duration, every aspect, whatever we did, it comes along with the what you call every aspect, whatever we have did, it is coming here as a printout. And also the what you call Risk assessment. Intervention will come in the next page. So this is what case study and how to use the eclectic counseling in counseling. So the both things we have discussed. Any doubts you people can ask. Any doubts you people have, you can ask. As far as the case is concerned or the case study format is concerned, this case study format we will be sharing with the diploma students. Hereafter in diploma, we will be using this format for we will every case study which we discuss, we will create this and we will write the intervention also, so that every month at least minimum 4 to 5 case studies you can have, the diploma students. This we can we will be sharing, and this we will be sharing with our internship students. So very happy to share that this year as on date we are having nine students from MA Jain College, and Auxilium College 7 students, and from Vellore St. Joseph's we are having 8 students, and at present we are having more than 25 students for internship, and further 8 students are going to join, and one person from Chhattisgarh has joined for the internship in MO camp. And today what we did is today Sunday, actually we have made our therapy room as a cinema theater. That is, it looks better than looks as equivalent to a very good theater with complete sound system. We have made the counseling room as a mini theater, and today we have seen a film also. So that giving a complete one is entertainment to the student and also learning. Yeah, Tim, any doubts as far as the case study is concerned, you can ask.
Sir, I have one doubt.
Yes, actually.
Sir, like you told that the therapy was divided into 8 sessions. So, sir, firstly, shall we tell the client that this therapy will be divided into further this much session? The client will have that patience.
Yeah, actually, one of the aspects is usually every therapist have their own methodologies. Usually, ethics, counseling ethics. For example, transactional analysis. Let us take T. Okay. TA says the first session we will understand the concerns and we will make a contract with the client that this will have this much sessions and this will be the payment, and this is how the counseling will move. So transactional analysis is having something called contract. Even in CBT, case conceptualization. So we may be telling the client it may take 6 sessions, but based on your based on our journey, the session may decrease or increase. Even in contract, TA contract, we will tell based on the therapy, either the session may decrease or increase, and we will get the approval from the client. That is what, as far as psychology is concerned. And every therapist have their own methodology. So usually what I do is, when they tell, I will tell them, see, let us have 2 sessions. Let us have 2 sessions. Then I will tell you how many sessions you will take. Because initially we will not be able to comprehend the depth of the problem. Whatever the client tells on the first day, we may not be able to see the depth. So 2 sessions. After 2 sessions, we may be knowing. And even charges also, it is not completely uniform. For example, for this client, for sessions we charged, hypnotherapy we charge separately. For hypnotherapy, we charge it separately. This is the amount for hypnotherapy. So even the payment, it will vary based on what is that you as a therapist you may be doing. Yeah. Any other questions, team?
Thank you, sir.
Thank you, Sakshi. Team, anything else?
Sir, how is MPD is different from this?
Which one? Can you just tell me the full form for NPD?
Sir, multiple personal disorder persons, people who possesses this multiple personality.
This is not
They
the
have
multiple personality because see in multiple personality disorder.
Sir,
they
sorry
not-
to interrupt you.
Yeah.
My doubt is how to find those when the people come with for a counseling. People they have possessed, right, sir? That was my question actually.
See, multiple personality disorder, if somebody is having the result of multiple personality disorder will be more. So in the beginning, it is highly doubtful that they will come to a psychologist. They may go to only a psychiatrist because that will have more serious consequences. So the first thing, they may be going to the psychiatrist only. Then if the psychiatrist tells for counseling, then he will go for assessment, maybe Minnesota. He will go for assessment through a clinical psychologist. Then he will come to a psychologist, maybe, or the clinical psychologist, he or she themselves will do the counseling. Suppose if it comes to the counselor, then the best therapy is CBT. The best therapy is CBT. Provided they are able to understand the therapeutic language. All the therapies, the main aspect is the client should be able to understand the therapeutic language. If they are not able to understand the therapeutic language, we will not be able to do counseling. So it all depends upon the severity and the various factors, which the clinical psychologist only will be able to tell.
But the substance use people comes under that only, right, sir? The people who are drug addicts,
drug
addicts, the people who are having the substance abuse from long time, who are having taking substance from last 15 years or 10 years, they come into these kind of counseling sessions and disorders, right?
The people who are using substance for a longer time, definitely they will have multiple issues.
Correct. Yeah.
And for them, actually, first is the psychiatrist only. The first aspect is psychiatrist, because they all need medications.
Okay.
So thank you very much, team, for joining. Okay. So
I have a question.
yeah, Juten, your voice is not coming. Juten, your voice is not coming.
Sir, I have a question.
Not coming. Juten, not coming. Team, whether Juten voice is coming?
Sir, now?
Team.
No, sir. No, sir. It's completely free.
No.
No. Juten, your voice is not coming.
Now it is clear?
Yeah, clear.
Okay, sir. Sir, actually, what are the things reflected in contract?
What are the things reflected in?
What are the things reflected in contract, which is
Contract.
made? Contract.
See, there are many aspects reflected in contract. That is the nature of the problem. Okay, presenting illness. Okay, and who is the client number. Okay, in case of emergency, whom to be contacted. Okay, the method of contact, when they will be having sessions. Okay, today most of the counseling, it happens in hybrid mode. The hybrid mode permission also will be sought in the a contract itself. Hybrid means today I am meeting a client. Tomorrow I will be having the counseling through WhatsApp. That is, I will check up whether he has filled up the thought record sheet. How was his day? That I will be trying to understand through WhatsApp. The third day, I may be connecting with him in Zoom call, maybe. Fourth day, he may be coming to office for a offline session. That means it is hybrid. So most of the time nowadays, all the three forms are used in all the counseling by all the therapists. And all these things will be mentioned in the
Okay, sir. Okay, sir.
contract, because some client may not like to be contacted in WhatsApp. So what is their how that they need, they want us to be contacted? That we will write it. Okay, team. Thank you very much. And yesterday we have started NLP with the incantations. Okay. If anybody wants to join NLP, we are giving NLP at the very, very subsidized program, subsidized rate, because 15 years we are going to complete. So very, very subsidized rate. The summer program we are giving. Summer program, it is having NLP, NLP practitioner, NLP master practitioner, and NLP coach. All the three it is having, along with health coaching. So if anybody wants to join, kindly get in touch with me or with the MO Care ladies.